Hey friends, today we're going to look at my peri-anaesthetic new grad journey as I started my nursing career straight out of university and went into a position in peri-anaesthesia. Welcome back to my channel guys. If you're new here, my name is Rory. I'm a clinical nurse specialist and a clinical nurse educator living here in Newcastle, Australia. On this channel I like to discover and explore the strategies and tools that you can utilise in education and personal development to become the best version of yourself. So let's jump straight in and have a look at my experience. So quickly, I was just going to talk a bit about university just quickly and about my experience about getting into theatres. I was very much keen to try out surgery and anaesthesia from a student point of view. I was lucky enough to get into the ED, and from there I was really trying to get into theatres and I just never could get into there. As close as I got, I almost got in, and at one particular public hospital nearby I wasn't able to go in because literally a week prior a third year fainted and I was in second year at that stage. No logic whatsoever, but I was restricted from going into theatres. So throughout third year I got another ED placement, and then I tried to get my final placement in a perioperative setting or in a peri-anaesthesia setting or in ICU or something, and I missed all of those things. So when I ended up at a district hospital, a really small hospital on a surgical ward, when I already was working on a surgical ward as an AN, I maximised my opportunities by completing my assessments quite early, and I actually got to go around the hospital and trial a few different things. The first area I got into was recovery, and from there I went into theatres with an anaesthetist, and this is where my life literally changed forever. So before coming to nursing, I had a pre-hospital care background and I had an aquatic rescue background, so I was very interested in drowning resuscitation and all things sort of airway, breathing, circulation. So in anaesthesia, where you do this in sort of more of a controlled sense, it was very interesting to me as a student. So I really loved the time I got to spend in this district hospital with this particular anaesthetist and with the nurses there working in recovery and in anaesthetics. It was just so much fun. So this led me to just chasing a specific theatre new grad position. So I applied for absolutely every position, and I was really stoked to get a peri-anaesthetic new grad position. So I started in peri-anaesthesia, and it ended up being an area that I just absolutely love. Okay, so let's specifically look at my program. As a new grad coming in or coming out of university and going into the workforce, I was looking at doing a peri-anaesthetic specific program. So it wasn't perioperative, I wasn't going through the surgical side. I was going through the peri-anaesthesia side, so it included 6 months in recovery and 6 months in anaesthesia, and then with the opportunity to possibly stay there in the perioperative setting or move through to the other side if I was interested in that side. So it was a decent amount of time to really consolidate your skills and knowledge in those two areas and really decide if you like it or not. My program came with the 12 months, had 4 study days and 1 chill day with the new grads together to finalise the year with a little dinner as well. We also had an abundance of in-service clinical education sessions, and then had my clinical mentors, CNSs, and also the hospital educator. So my first rotation was in recovery, and I remember my first day, obviously super excited, but you just forget that you have to go through inductions, orientations and stuff. So in the first week, we literally spent the first 3.5 days in an area where we were just doing normal sort of induction stuff, normal office stuff, but then we sort of on that first week, in the Thursday afternoon, we had a look out on the floor, we had a look at what was going on, we observed a bit, we got to meet a few people and just sort of got our faces shown. And on the Friday we were partnered with our mentor for the day, and we just sort of followed them around and looked at more at the flow of what was going on in the environment and observed what the nurses were doing throughout their shifts. So during the next week, which was week 2, it started my supernumerary time in recovery. So I was really with my mentor working in the capacity of what she was doing in terms of running through the flow again, running through the normal sorts of clinical cares that happened in the area, working with what sort of surgery came in, what days it was, how many staff we had, just getting the whole context of the care of recovery in this busy little recovery unit. And throughout that week I was really starting to get involved in the more advanced, specific, specialised skills that I hadn't done before, like the airway management, taking out laryngeal masks after patients emerge from general anaesthesia, supporting airways that aren't quite ready to be supported on their own yet, managing pain, getting involved in giving S8 medications and managing the pain actively as patients are at various levels of their emergent stages. So getting confident with the higher level skills was what I was doing in sort of that first week. So I wasn't looking after the whole patient, I was just concentrating on the airway stuff or on the pain stuff. So it was very specific as I was learning all the different specifics of recovery. So as I went into the third week, I was more having a look at the documentation and starting to get away from the more advanced skills and more practicing the more basic, taking a handover from an anaesthetist and really starting to take the overall care of the patient, getting used to the documentation, allowing the nurses in the team to do the other higher specific stuff. So something that I noticed straight away that was quite different in the recovery area compared to other areas, and it also happens in a lot of EDs, is there's a team nursing culture. So if you take the handover and you do the documentation and you sort of looking over the overall care of the patient, you might have someone else who does the airway management for you. You might have someone else who takes out the LMA. You might have someone else who's doing other things for you while you're doing that sort of primary role. So I found that very interesting and very helpful, and very the dynamic was interesting to work in with in a recovery sense compared to like an ED and compared to your traditional ward sense. Okay, and then in the fourth week, this was really the time for me to pull it all together. So in this time, I had a big list of things to learn. I'd identified a lot of the medications that I hadn't heard of before and or hadn't used much before, and I was looking at the specific uses and the dosages and getting familiar with all the protocols within the area. I was also getting quite competent with the airway management stuff, and I was getting quite familiar with the ways of managing pain, and I was really starting to pull it all together. And that was my week to really have my mentor step back and use my nursing team, but not so much of leaning on my mentor, to really become autonomous in that area. And by the end of week 4, between all of the different supports and all of the different things that was available to me, I was feeling very confident and competent to take on someone's care and continue developing my skills and knowledge and have fun in recovery. So I think the key thing with how it worked and how the program worked was that I had a specific mentor, and this person was someone who was experienced in this area, who was training to be basically a CNS, but they weren't quite there yet, and they were my go-to for the whole 6 months. However, I had 2 other CNSs in the department to go to for anything, and they were always available for me, and I was partnered with them throughout the supernumerary stage, and they were obviously in charge a lot of the time as well. I had the NUM, I also had the educator, so there's a lot of different support mechanisms there, as well as my direct mentor, which I found very, very helpful. So I think the key skills in recovery that was interesting and different for me was that patient assessment is a bit different in recovery to like ED and on the ward sense. It's a tiny bit more specialised. These patients have been affected by medications. They're not, had trauma or something, or some of them have, depending on what anaesthetic setting. But in terms of an ED versus anaesthesia, it's very different. And then in terms of ward versus, it's all very different. So in the context of anaesthesia or peri-anaesthesia, I think patient assessment was the first thing that I noticed was a bit different. Obviously, airway management is very specialised and very different. You use a lot of different equipment and a lot of different things day to day, every day, to manage airways. So that was also interesting. And I think the third and most important thing that was most interesting for me was the pain management. So pain assessment, you're still doing a comprehensive and a full pain assessment, but again, the patient's affected by medications. So this is very interesting in assessing someone's pain and managing their pain. There's also a lot of things they do in the theatre environment that also can change their level of pain and perception of pain. How much opiates have they had in theatre? Have they had a regional block? Did they have a GA? What was going on? Like what was the situation? So it's always good to look back and look at the anaesthetic record and get as much information as you can. The concept within pain management that I was quite interested to learn about, because I didn't really learn too much about it at university, was multimodal pain management. Very useful to have that in the back of my mind as I was managing the pain, to think about how many different ways are we trying to get at this pain and really help the patient out with this pain. Because as a student, I really thought that maybe the goal was to have no pain. But as I got into the world of peri-anaesthesia and learned a lot about surgery, I learned that they're actually having something happen to their body. So that the likelihood of there being no pain at all is actually not really realistic. So they're going to have some pain, but what is manageable and tolerable pain? And getting to a stage of managing and helping someone with their pain was something that I found very interesting to learn the knowledge of, and then to complete that skill of, and then ultimately help my patient out with and develop that as a new grad. I found very interesting. Okay, so on to my next rotation. My next rotation was 6 months in anaesthesia, and I was very much looking forward to this, getting inside the theatre environment, working with its multidisciplinary team, and seeing seeing all the action, seeing what happened inside those doors, and seeing what happened to my patient before they come out to me in recovery. So it was incredibly helpful for me to do recovery first. And when I first was doing my new grad, I was like, oh, they'd give me recovery first. Like, it doesn't even make sense. Of course it doesn't make sense, I'm a new grad. So I found it very helpful to do recovery first. So that 6 months really set me up. When I went in at that 6 month stage into anaesthesia, I was so excited to get in there, get behind those doors, and learn as much as I could. So in anaesthesia, I was partnered with a CNS right from the start. I was doing all types of surgery right from the beginning because I was working just next to her, seeing how the theatre worked. I'd never been in there before, so I was seeing how it run. I was seeing what different people did. I was seeing what our areas were, because peri-anaesthesia have specific areas of the theatres. So I was just observing absolutely everything, and I jumped straight in. General bariatric surgery, we're doing general anaesthesia, we're doing invasive monitoring, we're doing multiple infusions to maintain general anaesthesia, we're intubating the patient. Some of them are quite large patients as bariatric, so it was quite an interesting time to see all the different skills in anaesthesia. So I spent the first 2 weeks literally just observing and having a lot of fun as a brand new area and a very specialised technical area, and also learn all the specifics in the background about all the things you don't know about anaesthesia, like the technical aspects of it, learning about the machine, learning about checking the machine, learning about the old model of anaesthetic technicians and how to bring that into the world of today where we've got anaesthetic nurses, and to foster the technical part of the anaesthetic nursing. So after that, I got to spend some time doing some isolated high skills in some anaesthetic areas that I wouldn't be in for a while. So I went over to sort of the orthopedics, the higher orthopedics, and went into the cardiac theatre and did a few things in there with central lines and other things. But then I come back in that 3rd week and went into my role as a new grad anaesthetic nurse, and started taking on my own lists, scope lists, having another nurse for the first couple of days help me with cannulations and stuff, as I wasn't cannulating yet, and I was just trying to get in the flow of things, coordinating the patient flow and directly assisting the anaesthetist. After you get good at that, add the cannulation on. So that was really good, and then I progressed into dental general anaesthesia, and I went into back surgery and other types of orthopedic surgery that didn't involve too much nerve blocks, and other types of major monitoring involved. So it was very interesting period for me as a new grad, because I spent about 6 weeks and ultimately supported crazily interesting area where I got to do so many different things. And then after this sort of 6 weeks, I had my CNS and mentors available immediately in the area all the time, and I was running my own list on my own, doing my own thing then for that next sort of 4.5 months. And during this time, I had an absolute ball with all the nurses and all the doctors that I worked with, both in anaesthesia and in surgery. So the key skills to learn for anaesthetic nursing is, 1, learning the knowledge behind assisting the anaesthetist, but then also the skills of assisting the anaesthetist. I really learned off some very talented nurses. I learned some great skills from actual anaesthetic technicians back in the day. I worked with some great CNS nurses and some great other nurses that just had other great skills that they passed on to me. And the anaesthetists really respect and loved these other skills that had these really specific parts of them that really had fostered things that had come through for years. So I was really thankful for all of those specific things. Another big thing is learning how to set up a theatre environment. There's a lot of equipment that's used in theatre for not only anaesthesia but also surgery. So being able to help out with the team and setting up all of this equipment and working together is really important to be able to do that. It's part of your role in anaesthesia, but also being ready for your patient to have all the anaesthesia and the surgery that they need. And then there's a lot of specifics in between all of this depending on what type of surgery you're doing, but ultimately getting confident and competent with preparing your airway, breathing and circulation equipment depending on what type of surgery. And I found this, I just loved it. I just absolutely loved every part of it. I loved everything from the equipment, opening it up, testing it, to everything, to doing everything with the anaesthetic machine. I just loved everything in anaesthetics. So after my time as a 12 months as a grad, I actually spent a few more months working in anaesthesia. I went on and did the next year actually worth of cardiothoracic anaesthesia and working across all the major surgeries in that facility, and I got experience in vascular labs and cardiac catheter labs as well. But my time in the cardiothoracic theatre was very interesting because I got to work on coronary artery bypass grafting, got to work on valve repairs, got to work on thoracotomies, a lot of lung procedures, double lumen tube insertions. There was just so many things that was so interesting from an anaesthetic perspective over that year. And then I sort of moved on after that time. I went and did some other things in other areas. But long story short, I came back to anaesthesia because I absolutely love it. So I'm there in anaesthesia. I worked a few more years. I actually ended up specialising, and now I'm an anaesthetic clinical nurse specialist, and I also spent a few years as a perioperative clinical nurse educator. However, now I'm working more as a hospital clinical nurse educator, but I still absolutely love peri-anaesthesia and my specialties, which I absolutely love to work in. So some tips for you if you're going on a peri-anaesthetic journey yourself, whether it be anaesthetics or recovery. You are going to learn every single thing that you need to know on the job, supported. Okay? There is obviously going to be things that you need to take home and learn, things that you need to brush up on, things that you need to look up outside of your work hours. However, you're going to learn and be supported on the job to be empowered to become the best peri-anaesthesia nurse you can. And if you love it and you stay after your new grad year or after your first period as a nurse in theatre, you can always go on and specialise or go on to other areas or other hospitals that do different types of anaesthesia services and look after different patients in recovery and stuff like that, so you can get more in-depth experience. The last thing I'll say is when you get there, just jump in, get involved, ask a lot of questions, and just have as much fun as you can. Because as a new grad, it is your ticket to keep learning. You go out there as a nurse. Yes, you're not a student. You're a nurse. You've got responsibility. You've got duty of care. You can also earn money. Okay, but it's also a great time to keep learning, developing your skills, and just have so much fun. Alright, because it does go very quick, and after that supported year, you're very much like the rest of us, out there working hard, and sometimes, depending on the hospital, there's not as many services or resources available to you to learn all these great things, especially overnight and stuff like that. So really utilise that time as a grad or a new nurse in the area to have as much fun as you can, but learn everything you can as well. Alright guys, hope this has been helpful. I hope you've enjoyed this video. If you have, please click like. If you like what you're seeing here, click subscribe as well. You'll see a few more videos coming up. And thanks for watching, and all the best with your nursing journey. Cheers.